Hi there, I'm Tim Friel and I'm going to do a very brief introduction on how to use the clinical camera that we use in the department. This will allow you to get good quality clinical photos that you can use in case presentation. Before you take any clinical photographs of patients, you need to ensure that you've got their consent to do so. And as well as explaining what you're going to be doing to the patient, you need to get a consent form signed and give a copy to the patient. This is the departmental form that we use, and it's very straightforward. What you need to do is to explain to the patient what you're taking photos of, i.e. the teeth, why you're doing it, which might be for a case presentation or teaching purposes. It's also particularly important to make sure that you tell the patients that the pictures of them will be stored on a computer file. And in doing so, you've got to make sure that the pictures are not traceable to the patient. So you shouldn't put the patient's name on the JPEG that you create. After you've filled in and got the patient to sign the consent form, you give them a copy to keep. Okay, I'm going to give you a very basic overview of the use of this camera. There are three parts to the camera. There's the body, the lens, which in this case is a macro lens. This allows us to get very close-up pictures of teeth. And then finally there's a ring flash which is mounted at the end of the lens to allow us to get enough light. When you use the camera, before you use it, you need to set these to the correct settings, and then you'll be able to take good quality photos every time. The advantage of this type of camera is that it's so sophisticated it will do all the work for you once it's set properly. So I'm just going to go through some of the individual settings. Okay, the first thing that you need to do is obviously to turn the camera on. And when you do so, you'll find this display on the back. Usually the camera will be set automatically for you, and you shouldn't need to make any changes. But the key things you need to know are, firstly, that the flash setting should be set to 1 in 200 or 1/200th of a second. And the f-stop for most pictures should be set to f22. If you need to change that, which you will do occasionally, you can press on the AV button next to the camera and then turn the dial to make the f-stop bigger or smaller. But for most intents and purposes, if we leave it at f22, that's fine. When you first switch the camera on, you'll see that on the top of the body there is a dial. This should always be set to manual, which is the M letter, and that should be adjacent to the white bar. Having a manual setting allows you to control any other settings yourself. If, for example, your picture is too dark, you can lighten it. Looking at the lens, the two things that you need to know, first of all, is that it should be set to manual focus. You can use an autofocus setting, but we don't need that in dentistry, and I will show you how we focus later on. So always set the focus to manual. The other setting on the lens is to adjust the macro setting, and if you turn the dial, you'll see that there are these numbers on the side of the lens. And this takes the lens from a 1:1 macro position, which would be an extreme close-up. You might use that if you just want to take a photo of a single tooth. But most of the time it's going to be set to about 1:3. And that will give you a full mouth picture quite nicely. The third thing that you need to do is to set the flash. And really the flash does all the work for you. All you need to do is to remember to turn it on. When the flash is ready, a red light will appear. Okay, so now that you know all of that, we're ready to take some photographs. Okay, so obviously we need a willing subject. Hello, Ben.
I do.
Do you consent to me taking photos of you?
I do.
There we are. Right. Now, when we're taking photos, infection control is paramount, and it can be very difficult to achieve with the camera. So what you need to do is to make sure that if you're wearing gloves, set the patient up, then remove your gloves so that you can take the picture. It's much easier if you have a nurse, obviously, to do that, or someone to help you. What I'm going to do is going to take a few shots of Ben's teeth. These are the standard pictures that we would use for dentistry. First thing that we need to do is to put on a clean pair of gloves. And then we're going to use a cheek retractor so that we can actually see the teeth. These are the cheek retractors which you will get from CSSD. They'll be sterilised before use, and they have a wider end and a smaller end. And I'm afraid, Ben, there's no easy way to say it, but you're the wide end. Okay, so open nice and wide, and what you do is place the cheek retractors into the cheek, just relax, and then you can ask the patient to close together. Bite together. And actually, if you're working on your own, the patient can hold the ends of the retractors for you, and that frees you up to take the pictures. If I want to take a frontal picture of Ben's teeth, then what I'm going to do is I'm going to set the macro setting to about 1 to 3. Remember to turn the camera back on and to turn the flash back on. I don't need to set anything else on the camera. This will automatically give me the picture that I want. In order to take a photograph, then what I do is hold the camera, supporting it underneath, and focus by moving in and out until the teeth come into focus. So at the moment the teeth are out of focus, and by moving in I can see a clear picture of them on the screen. Now if I'm taking pictures of the front teeth, I want the lateral incisors to be in focus. So once they're in focus, just press the button, and the camera really does all the work for you. Let's just get that back up again. You can see everything that you need to see. Now, we could have used a little bit more retraction, and perhaps with an assistant that would have revealed more of the back teeth. But really, the camera does all the work. If I wanted a much closer up view on a tooth, then what I'd do is I would turn the lens so that it gives a 1-to-1 ratio. And what you'll find is that when you focus in on the tooth, the camera will need to be much closer to the body. So again, what we do is support the undersurface of the camera. The picture's well out of focus, and I actually have to move in really, really close to focus in on the teeth. And you can see the result. It gives us a much closer up view on the front teeth. It's a little bit brighter than the other picture, but the flash and the camera have compensated for the closeness. Again, it's really done all the work for you, and you can see that Ben's cleaning his teeth nicely. Okay, I'm going to go through the basic shots that you're going to use for close-up dentistry. I'm not going to be talking about full face photos.